Thank you. Thank you. I would like to call the meeting of the special open board meeting of the Erie St. Clair Local Health Integration Network to order. First item, I would like to a motion to move item 2 and 3 up ahead of my welcoming remarks. Joseph, Mike, second. All in favor? Carried. Thank you. Next, we need a motion for approval of the agenda. Barb? Second. Joseph? All in favor? Thank you. Third, declaration of conflict of interest. Seeing none, we'll proceed. First of all, I would like to thank you, all of you, for coming here tonight. Clearly, you know this is a major issue, and that's why it's engendered so much interest. It is a special board meeting, and we will have presenters who will present to our board, and the board will, members will be able to ask questions of the presenters. We have both formal presenters representing groups, following which we will have a quick break. But in the meantime, if you have to use the facilities, obviously you can feel free to do that. As you know, we also will have presentations by the public, and we have a list of individuals who have signed up for that, both online and here in person. Leamington District Memorial Hospital has made, after extensive study of the communities they serve and review of their present programs and services, a proposal which in their judgment better links the needs that they are required to meet within their available resources. This proposal also lays the foundation for sustaining the hospital in the future. All community health agencies across Ontario are required to operate within a balanced budget. This applies to all LHIN-funded healthcare agencies such as the CCAC, community health centers, and of course hospitals. Leamington's proposal tonight is an attempt to meet that requirement. The hospital will tonight be presenting to us the details of that work. Although it appears to be the topic of main concern, it is possible that we need to consider the entire package that's being presented. The entire package, of course, is entitled The Alignment of Sustainable Hospital Services. And you've seen a chart, I'm sure, that delineates the specifics of that proposal. And as I said, the hospital will make presentations to us in a few minutes. Following the hospital's presentation, we will hear from community leaders, from healthcare stakeholders, as well as from local residents. So tonight is about listening. As a LHIN, a local health integration network, we share your goal to keep a sustainable hospital in this community for many years to come. We will then have a quick break, following which we will hear from the public who have registered. In addition, I do want to mention that we have comment cards you can fill out and leave with us, as well as a video grapher where you can record a message to us. Shannon, he's out front, I think. So in other words, that's a process where if you're not in the list to present or you haven't registered with us, you can actually go there. He will tape your comments, and we will get those tapes from him. So he produces a video for us. So we're trying every medium we know to get input from you. Each presenter has been allotted specific time, and Shannon Sasseville, who we'll introduce in a few minutes, will inform you when you have 1 minute left and when your time is up. So we have much to hear tonight, and therefore we want to be as efficient as possible so everyone who wishes will be able to have input. I'm sure all of us will do our utmost to accomplish this. You will notice from the agenda that the next steps at the end of the meeting will provide us an opportunity to reflect on what we've heard tonight and make a decision on where to go forward. As I mentioned in my briefing, we probably will not, nor should we, make a definitive decision tonight. We need to hear from you. We also need to analyze, to consider, and to ruminate on what we hear. So the sense we have is that, and it's up to the board, and I can't really speak totally for the board, it's up to them to decide at the end of the meeting. However, the expectation is that tonight is yours, and for us to hear. I'd like now to introduce our board members. So if we could go starting with Joseph, they will tell you their name and what county they're from. Joseph?
Joseph Isner from Windsor.
Barbie Arneson from Windsor.
Mike Lowther from Chatham, Kent.
Gary Switzer, I'm the CEO. I live in Tecumseh.
And Martin Jarash, and I'm the chair, and I'm from the county of Essex.
Lindsay Boyd from Blenheim, Kent County.
And I'm Ralph Ganter, Senior Director of Health System Design, and I actually come from Sarnia.
And Shannon's around somewhere.
Yeah, I'm down here, way down here.
Okay.
Shannon Sassville, Director of Communications, Public Affairs, Organizational Development, and I'm from Chatham.
Thank you, and thank you. And we have on phone, who is not able to join us today in person, but is on phone with us, one of our board members as well. Robert, do you want to introduce yourself? Yes. Robert Bailey is from Essex County. So, a few remarks first of all. What is a local health integration network? A LHIN is a crown corporation established by the provincial government in 2006 to replace the Ministry of Health and Long-Term Care regional offices and the district health councils, and to assume some responsibilities formally with the Ministry of Health and Long-Term Care. The primary objective of establishing the LHIN network is to allow for community input and for decisions regarding health care to be made closer to the community. Clearly, that's what we're trying to start tonight. LHINs are governed by a local board of directors in order to provide the local communities more direct input than occurs with larger regional health authorities as occurs in other provinces. There are 14 LHINs across Ontario, and the Erie St. Clair LHIN, which is us, have responsibilities for Essex, Kent, and Lambton counties. LHIN's primary responsibilities are planning, integration, performance, and funding of most healthcare organizations. Not all, but most. Our LHIN region goes from Granby through to Windsor and includes Pelee Island. LHINs are community-based, non-profit organizations funded by the Ministry of Health and Long-Term Care. We plan, fund, and coordinate health services, as I mentioned, delivered by hospitals, long-term care homes, community care access center, community support service agencies, mental health and addiction agencies, and community health centers. One of the most important roles we have is community engagement. Tonight's meeting is a method for that engagement. There are also, as I mentioned, many other ways to contact us, so if you're not able to speak to us tonight because of time or you chose not to, you can contact us by email, our webpage, call us, or you can even send a letter. So let's begin our presentations. I will call the presenters up to our podium. The reason we're having them come to the podium is that we are also webcasting these presentations in this meeting, and we have to do that through the mics at the podium. So if the presenters will please state your name, your position, and the organization, if it's relevant, which you represent. Also, following today's presentation, please provide us with a written copy of your presentation so we can be sure to have received all of the information you intend us to receive. Please come to the podium when called as we're ready to begin the session. And the first presenter will be Leamington District Memorial Hospital. We have John Newman, past chair, and Terry Shields, CEO. John and Terry.
So good evening, and thank you, Mr. Drash, for the invitation. My name is Terry Shields, and I'm the Chief Executive Officer of Leamington District Memorial Hospital. I am joined today by John Newland, a long-term board member with the hospital. So we're going to talk about the study that was done over the last 7 or 8 months in cooperation between ourselves and the Erie St. Clair LHIN. So who we are first, I think the people in the crowd know. Leamington District Memorial Hospital is located along Essex County South Shore, and we serve the communities of Leamington, Kingsville, Essex, and Wheatley. We have nearly 700 ambassadors. Those are comprised of staff, physicians, volunteers, and our board of directors. We provide emergency room service. We see approximately 29,000 to 30,000 patients annually. We provide medical care, inpatient and outpatient surgery, a full suite of diagnostic services, restorative services, and recently we have been expanding our partnerships to improve access to care to the communities we serve. So the full report is on our website. What you're going to see here are some pages that help us speak to the point. We thought it was important to use the information from the website to be as independent as possible. Knowing perfectly well that I am not independent, I do work for the hospital. How did we get here? We lost approximately $700,000 in health system funding reform over the last 3 years. However, we've been able to stay in a balanced position by rationalizing management expenses and making sure we did not cut services that are patient-facing. The Hay Group found that Leamington's performance, especially in 13-14, makes it one of the most efficient, smaller hospitals they have ever worked with. The loss of approximately $1.2 million in Assess and Restore one-time funding on an annual basis happens this December. For this fiscal year, it's approximately a little bit less than $800,000. We've been working with the Erie St. Clair LHIN to address structural issues over the last 18 to 24 months. Funding reductions have created approximately a $2 million issue. Collectively, between the LHIN and ourselves, we agreed to retain the service of an independent third-party consultant to address these issues. The department objective was to create a sustainable hospital model. 2 basic questions were asked. What are the needs of the community served by the hospital? And what is the appropriate role for Leamington District Memorial Hospital in meeting the needs of this population? So this seemed quite busy, and it is, but I wanted you to see this. The evaluation criteria for selecting the future role of the hospital is broken down into 2 buckets. Health-related criteria, which includes maintaining the ED and inpatient acute care services at the hospital, and ensuring access to needed hospital services for the local community. Furthermore, another example is contributes to the fiscal strength of Leamington District Memorial Hospital. Socioeconomic, hospitals are a big part of the community, right? They help to attract and retain communities. And that is what the socioeconomic criteria speaks directly to. So our current services, we have an emergency department, again, that sees approximately 29,000. Inpatient medicine, inpatient surgery. Critical care, a level 2 intensive care unit. Birthing, outpatient surgery, outpatient clinics. Comprehensive diagnostics and therapeutics. Assess and restore, complex continuing care, and palliation. The current service volumes, and I'm not intending to read these numbers to you, except with the exception of emergency department visits. We do have to keep those over 29,000 visits, so I want to make sure everyone's aware of that. You can see it on this page, but this is really key. It actually tells you what the priority of services are based on volume and based on utilization. Our occupancy level for those beds, medical surgical beds, is 96%. ICU is 54%. So that's based on 3 beds. From a practical standpoint, how we utilize the beds is we have 2 beds and we have 1 surge. So if you do it on 2 beds, the occupancy level goes up to 81%. Same as obstetrics. Obstetrics has 8 beds. We utilize 3 beds. The other 5 beds are actually used for overflow for med surg. So 37%, a little bit of a misnomer. It's actually about 55%. The best way to look at this is for a total acute care, we're approximately 86% occupancy for our beds. Complex continuing care is approximately 87%. So what are the future needs of the hospital? So if you go to our website, you can pull down the entire report. However, some key points. Essex County projected change in population by age and gender. Virtually no projected change in total population from 2012 to 2020. But the population aged 65 and older will increase by nearly 30%. Those over the ages of 65 will shift from 15% to 20%. Need for obstetrical service and catchment population will decline modestly up to 2020. Selecting future role for Leamington District Memorial Hospital. So a lot of words on this page, so I'd just like to take a moment, and when I took over this role, Dr. Guman came and saw me and gave me a quick lesson. So I'd like to share that lesson with you. I'm assuming everyone knows who Dr. Guman is. He's our chief of staff. One of the finest gentlemen you'll ever meet in your life. So he sat down and he told me, if you're going to have an ED department, you have to have acute care beds. If you're going to have acute care beds, you have to have an ICU. If you're going to have an ED, an ICU, and acute care beds, then you need general surgery. And to make all of that run, you need diagnostic and therapeutic services. So that quick little training exercise, Paige just used a whole bunch of words compared to what Dr. Guman taught me. So at the top of the page, you will see that 85% of the residents in Leamington and Kingsville rely on Leamington District Memorial Hospital for ED visits. For you, we say thank you. For the other 15%, we say come home. The ED projected growth going into the future, you can see in 2014, we're approximately 29,000, projected to top 30,000 by 2020. We are number 1 in Erie, St. Clair, LHIN in ED wait times. So I need to take a moment. We participate in a program called Pay for Results. Technically, we're not actually supposed to be participating in that program. Due to the generosity of the Erie, St. Clair, LHIN, we receive funding and have for a number of years, and we've taken that funding and achieved better results and invested in our community. For that support, we say thank you. The next couple of slides, I'm not going to go through the number, but the message is clear. The demographic change will result in an increase in inpatient cases. A 16% increase in inpatient cases and 24% increase in inpatient days. So as we get older, the utilization of the hospital is expected to increase. The demographic change will result in an 8% increase in outpatient surgery. The fact of the matter is, I think that number is going to grow substantially more than that. We've been expanding our orthopedic surgeries, thanks again to the Erie St. Clair LHIN for financial support to allow us to do that. And we expect this number to be much higher than 8%. Considering birthing, Leamington District Memorial market share has increased. We have done a lot of marketing with regards to this. You can go to our website. You can see the efforts that we made with respect to this. Again, the need for obstetrical service in the catchment population will decline up to 2020. There is a disconnect between volume and cost. The evaluation suggests that Leamington District Memorial Hospital should discontinue its birthing services. Sorry about that. So what's the implications of eliminating birthing? 300 women in the catchment population who currently rely on Leamington District Memorial Hospital would have to travel to Windsor Regional Hospital. Windsor Regional Hospital is more clinically and technically sophisticated. We're not trying to compare an apple to an orange. Okay, they're a level 3. They have neonatal care. They're fine, and they do a fantastic job for Essex County. Dislocation for these women can be mitigated if we offer pre- and postnatal care. We've had discussions with Windsor Regional Hospital, and those discussions will continue next week. Leamington District Memorial Obstetrician, who is here today, Dr. Chan, has secured privileges at Windsor Regional Hospital and will maintain her office at Leamington District Memorial Hospital. Considering post-acute. Assess and Restore, Ministry of Health and Guidelines tells you it's more of a philosophy than it is a program. We've had Assess and Restore in our building for approximately 3.5 years. It was set up as a pilot program, and this was probably the biggest point of contention between the hospital and the LHIN. Expectation was if you delivered, you should keep it going. Okay. So Leamington District Memorial Hospital, independent, Leamington District Memorial Hospital Assess and Restore program is very effective and highly valued approach to care as recognized by the third party, the Hay Group. Recommend that Leamington continue with the philosophy we have of picking up patients in acute care and applying rehab to them so they can go home versus going to long-term care. The LHIN increase our CCC beds, complex continuing care beds, from 5 to 10 to better serve the catchment population. Leamington provide post-acute portion of the A&R service in these 10 complex continuing care beds. So as we transition to the future and we create a sustainable model to ensure this hospital stays in this community, the result is this. On the left-hand side of the page, I already told you what our current role is. On the right-hand side of the page, I highlighted a few items that are different. The first one is birthing. We will no longer be offering birthing at Leamington District Memorial Hospital, effective March 31st, 2015. Our intent is to offer pre- and postnatal care at Leamington District Memorial Hospital in cooperation with Windsor Regional Hospital. Outpatient surgery, I just highlighted this because a lot of the focus and a lot of the growth going forward is going to be orthopedic surgeries, outpatient orthopedic. Complex continuing care is also highlighted because the beds are going to be expanded. The recommended beds are going to be expanded from 5 to 10. The resulting bed configuration, today, we have 69 beds. Effective April 1st, 2015, the proposal would see us go to 62 beds. Our medical surgical beds will go from 53 to 49. Our ICU will remain constant. Complex continuing care will go from 5 to 10. And the OB birthing beds, 8, only 3, would go down to 0. So the beds would go from 69 to 62. However, based on changing demographics of the population in the communities we serve, those beds are expected to increase to 76 by 2020. So our motion. The foundational motion is what we talked about at the very beginning. Funding reductions, and funding is tough for every single hospital. It's not just us. Health system funding reform, over the last 3 years, we lost approximately $700,000. We have made gigantic strides to get our house in order. However, the motion is as follows. This is an excerpt from the motion. Due to the funding reductions, the Leamington District Memorial Hospital Board of Directors has improved the reconfiguration of program and services to focus on the emergency department, internal medicine, inpatient and outpatient surgery, restorative care. As a result, Leamington District Memorial Hospital will cease offering birthing services effective March 31st, 2015. Thank you. John?
My name is John Newland. I've been on the board for 13 years. I'm the past chair. And what you've just seen is what we had to digest over a period of time. These are the cold, hard facts. But what I want to try to make sure that everybody in this room understands that the board of directors also realize that there are more than just cold, hard facts. Like I say, I've been on the board for 13 years, and I was the chair from 2007 to 2009. And the OB unit is one that has always been looked at very, very carefully. We have always been very careful to ensure that this unit has been a part of our hospital services. We have moved physically that department around. We've merged it with Med-Surg. We've done a number of things to ensure that this unit stays here.